In our morning rounds, the growing cost of prescription drugs. A new report says total drug spending jumped last year by 3% to nearly $330 billion with a B. That's reversing a recent trend. For those who take generic drug prices, they have come way down. But for people who take what are known as specialty medicines, the costs are really soaring sky high. One new drug, for instance, is for hepatitis C. It runs $1,000 per pill. Wow. Our Dr. David Agus joins us from Los Angeles. Dr. Agus, it's always good to see you. First, I want to know, what does this pill do, and why does it cost so much?
It is actually a remarkable pill because it takes hepatitis C, which was a disease that was hard to treat before. Only about half of people who went through a really rigorous course of medicine actually got better, and it was a lot of side effects. And this pill is once a day for 12 weeks and gets rid of the virus in almost 95% of people, yet they charge $1,000 a pill. You know, there are two sides to the story. The drug company says it costs $1 billion to make a drug, and we need to recoup our investment. We need to be incentivized to make new drugs. And at the same time, there are 3 million people with hepatitis C in the U.S., 150 million worldwide, and they need this drug. It's a monopoly. They can charge whatever they want.
What other so-called specialty drugs are also extremely expensive?
So it's the new class of pharmaceuticals, whether it be a new drug for cancer, for hepatitis, for rheumatoid arthritis, multiple sclerosis. These new drugs represent 1% of prescriptions, yet over 25% of costs. So a new drug, it's predatory practice. You have a monopoly. You can charge what you want and what the market will bear. The drug companies say, well, over time it pays off because they work better, less side effects, but pay all the costs up front. We need to get more involved here.
So you're saying the cost is not justified?
I'm saying is that the system can't handle the costs, and it's not a rational-based pricing. We need to have pricing based on return to the patient.
I like that phrase you just said, predatory practice. What can we do?
Well, we have to do something different, and we have to, either start to regulate this so we can say what is the value to the patient or to the system, and we need to change how we're doing things because it's not right. What if you went to pharmaceutical companies and said, listen, patients should only pay if the drug works? We need to incentivize for innovation as well as make appropriate pricing so we can all benefit from these drugs and push the companies to make new exciting drugs because we need them.
But I would assume, and you may make this point, I was assuming that the drug companies would say, we spend a lot of money on research and development for things that don't pan out, and we need to get some kind of return on those that do.
There's no question. There's got to be a balance there. But at the same time, there has to be some rational pricing. If you have advanced cancer and I make a new drug, I can charge whatever I want, and the insurance company will pay, or you have to pay out of pocket. There needs to be some rationale, because when you have this monopoly that is a new drug that's the best in its class, you could charge what you want.
Yeah, and it appears, though, David, right, that the only people that could push that type of change would be the government enacting a law, and that might be legally a bit dicey, correct?
No question about it. It's not clear who's in charge here for pricing of drugs. Okay. It's not the FDA. They're not involved in pricing at all. And how do we create leadership so that we can actually get some change here to make a difference?
All right. Dr. David Agus, good to see you. Thank you so much.